Hello! Today we're going to be discussing a little bit about generalized anxiety disorder in young adults, and this presentation is brought to you by Team 1, Abigail Lamb, Alvaro Bodero, Andres Alvarez, Isadora Ferber, and Jordan Milano. First, let's talk a little bit about the rationale we have for the anxiety prevention of young adults. Mental health in modern-day American culture is often a taboo topic that is avoided. As time's gone on, there's been much more attention brought to this topic, more specifically within anxiety, which has become a far more prevalent disease within our culture. Addressing such is pivotal to the improvement of American public health for individuals of all ages, but more importantly, those in college, or of that age, who are facing the challenges of transitioning into new lifestyles and becoming adults. Because of the distress college students and young adults are forced to deal with, acknowledging their mental health condition and openly discussing it will bring more attention to the normality of such conversations. Current societal influences such as the general election and the effects created by the ongoing COVID-19 pandemic will most likely contribute to increased anxiety levels among young adults.
Moving on to the social and behavioral sciences as one of our public health core concentrations and the findings I found in my preliminary research. So there were certain risk factors that I found, such as smoking, drinking, sex, financial status, and activity level. And those were risk factors associated with anxiety diagnosis. So according to a study conducted in 2006 that used the Behavioral Risk Factor Surveillance System, otherwise known as the BRFSS, people aged 18 to 24 were more likely than adults aged 55 and up to receive a lifetime diagnosis of anxiety. A correlation was found between smoking and drinking with anxiety diagnosis, and we'll go more into that in our biostatistics section. Females were more likely than males to receive a lifetime anxiety diagnosis. And adults who reported being physically active were much less likely to have a lifetime diagnosis of anxiety. In other words, people who exercise more generally tend to have less anxiety. Another study conducted by the Max Planck Institute of Psychiatry, Clinical Psychology, and Epidemiology found a correlation between anxiety and poor financial situation. Similar to the other study, a high prevalence of anxiety was found in younger age groups, specifically in the 14 to 24 age range, and that supported the findings from the other study I previously mentioned. Going back to the correlation between anxiety and poor financial situation, this has some implications in the current financial climate of many college-age students, especially with the employment crisis brought about by COVID-19.
Hello, my name is Jordan Milano, and I will be discussing the epidemiology portion of our project. To begin, I would like to introduce the fact that 1/3 of the population is affected by an anxiety disorder at some point during their lifetime. This just goes to show how prevalent these disorders have become within our society. Furthermore, anxiety disorders have been shown to be significantly impairing to those who may be affected by them. And although this may be true, many affected individuals do not contact health services to receive treatment. It has also been found that there is a difference in the prevalence of anxiety disorders between males and females within our society. More specifically, 1 in 3 women will meet criteria for an anxiety disorder at some point in their lifetime, compared to only 22% of men meeting the same criteria. Furthermore, young adults and college students are also affected by anxiety disorders. In a study conducted at a public university in Ohio, 15% of students reported severe or extremely severe anxiety. This anxiety was influenced by several factors, including academic performance, pressure to succeed, post-graduation plans, and financial trouble. Overall, it is interesting to see how many people are affected by anxiety disorders in our population, as well as how specific subgroups, such as women and college students, may be more affected than others.
There are a large number of biostatistical studies that have been conducted about anxiety in young adults. These will be discussed in greater detail in our final paper, but for now, these are some of our preliminary findings. First off, 80% of both undergraduate and graduate students report stress levels varying from moderate to severe. This is a huge portion of young adults and shows how significant this problem actually is. Next, I wanted to talk about some aspects of college life that are correlated with fluctuating anxiety levels. To describe these, I'll be using R values, where a value of 1 indicates a significant positive correlation, while a value of -1 indicates a significant negative correlation. So first off, academic distress had an R value of 0.45. Grades are what determine a young adult's future in many cases, so it is easy to see why academic concerns could increase their anxiety. Second, college can be very expensive and can cause some financial difficulties. In fact, 62.5% of college students state that they periodically face stress due to finances, while 7.5% state that they are in a constant state of stress because of their financial situation. When compared to anxiety, financial stress shows an R value of 0.2, also indicating a positive correlation, but not as significant as academic distress. On the other side of things, familial and peer support both have negative R values of negative 0.17 and negative 0.16 respectively. Being a negative value, this means that the more familial or peer support one has, the lower their anxiety levels should be. This makes sense as people often look towards those close to them to get through hard times. Also, one study found that social media use is significantly correlated with raised anxiety levels. However, we didn't have an R value for this finding. Still, this is not surprising given how it can waste time or lead to some peer stress. Finally, we found data about how anxiety can actually lead to negative behaviors. For example, those with anxiety are 53.8% more likely to binge drink and 31.3% more likely to smoke. This is a little bit concerning as these behaviors will simply increase their anxiety in the long run, placing them in a difficult cycle to get out of. Overall, these findings clearly indicate that anxiety is a major issue for young adults and interventions must be made.
While there is not much policy or management that specifically addresses mental health issues like anxiety, some policy and management for these issues do exist. Most of these policies do not focus on anxiety specifically. Instead, they focus on mental health in general. However, since anxiety does fall under the umbrella of mental health, these policies can be seen as affecting anxiety in addition to other mental health issues. One example of these policies are the guidelines set forth by the CDC to help cope with stress. These guidelines can be found on the CDC website. They are meant to be used when people feel overly anxious or depressed due to circumstances they could be facing. The guidelines were last updated on July 1st, 2020, specifically to adjust for the growing needs of the population due to the COVID-19 pandemic. Within the guidelines, the CDC states the importance of taking care of your mental health. They offer resources that people could use to contact agencies that specialize in dealing with mental health issues. They encourage friends and family to support each other and give examples of which friends and family are the most likely to be affected. Lastly, they propose preventative measures and solutions to keep anxiety and stress levels down, such as keeping your body healthy and knowing where and how to get treatment if necessary. Another example of policy is the ACA, or the Affordable Care Act, which was passed in 2010. Three stipulations in the ACA have an impact on mental health. They are making mental health coverage mandatory for health insurance companies, adding pre-existing conditions, and extending the age children can be under their parents' health insurance plan to 26. Prior to the ACA, mental health issues were generally not covered by health insurance, making it more difficult for people to seek treatment for mental health problems. The ACA corrected this, allowing for people with health insurance to have access to mental health care. The second stipulation makes it illegal for insurance companies to discriminate based on pre-existing conditions. This made it possible for people with already existing mental health issues to get a job and continue getting the treatment they need. The last point pertains specifically to young adults. Before the ACA, children could only stay covered in their parents' healthcare plan until the age of 18. Most 18-year-olds then chose not to get health insurance because they were young and healthy and didn't think they needed insurance. Many, though, failed to consider their mental health in the decision, causing any mental health problems to grow and to fester. By extending the age to 26, these previously uninsured young adults now have better and more affordable access to mental health treatment plans.
Our proposed intervention contains two parts and was created based off of two important points regarding anxiety disorders. The first is the relatively high prevalence of anxiety disorders among young adults and college students, while the second is that many affected individuals of anxiety disorders do not attempt to receive treatment for their disorder. In order to combat these issues, we felt that the proper intervention would be to mandate that all students being admitted into a public or private university be screened upon entry for a mental health condition by a qualified mental health professional. Furthermore, since young adults may not attend college after graduating from high school, we felt that new employees hired to entry-level positions should also be screened for a mental health condition upon being offered the job. The two parts of this intervention will allow us to target the young adult population since they cover the two major routes young adults may take after obtaining their high school diploma. We feel that this intervention could help lower the number of affected individuals who do not receive treatment for their disorder, as well as allow for early intervention if a mental health professional feels that someone may have an undiagnosed mental disorder. Intervening and providing treatment before the individual acquires their new role of student or employee may allow for a lower risk of significant impairment after they begin their new position. In terms of the social ecological model, our intervention would target the policy level of the model. This is due to the fact that we hope to implement new policy that will affect a relatively large subset of the population. Creating an intervention to affect such a large portion of the population would be difficult to do with an intervention that works at the lower levels of the social ecological model, which is why we felt that we must choose a higher level and allow the new policy to affect our desired population.